The big question guiding my research is, how do we make health insurance markets work? So I think there's sort of two big sets of approaches for expanding health insurance within the US health insurance context. One strategy is to say, well, the big barrier is affordability. People just can't afford health insurance. So we need to have extra subsidies, extra financial assistance to make health insurance cheaper. That was actually the main theme of the Affordable Care Act reforms. It really aimed to make affordable health insurance available to all. And we have evidence that made a big difference in the past. But that strategy has somewhat hit a wall. When we look in the data and look and ask, what insurance do people who don't have health insurance today qualify for? It tends to be that many of them already qualify for subsidized coverage. And a large share of them, up to 40%, already qualify for $0 health insurance. That leads to the second strategy that you can use to expand coverage, which is to say, can we make it easier to be insured? Can we remove hassles and frictions that make it more complicated to be having health insurance than to be uninsured? We've seen an unprecedented increase in Medicaid enrollment during the COVID-19 pandemic. And one of the biggest reasons is that Medicaid agencies aren't imposing as many recertification requirements on enrollees. So every few months, in normal times, enrollees in the Medicaid program have to recertify that they're eligible. They have to complete paperwork, they have to make sure that they submit new pay stubs to show their income, and it's a big hassle. And what we've seen is that as that hassle of recertification has been paused during the COVID public health emergency, enrollment has increased dramatically. Now what's coming when the public health emergency ends is all beneficiaries will have to start recertifying regularly again. And that makes sense. We want to make sure that Medicaid is limited to people who really need it, but it also imposes a big hassle on beneficiaries. And the question is, how much do those hassles matter? And secondarily, how could government policy be designed in a way that minimizes those frictions and hassles so that people who need health insurance and qualify for programs are able to make it through the process? Increasingly in social policy, researchers are asking, how could we design the process of enrollment in a smarter way that makes those hassles less? And what we were able to do in this study was zoom in on a specific set of policies that actually changed over time in Massachusetts for how you enroll in public health insurance. And we were able to see when there was more versus less hassles, who got enrolled. And it turned out there were sort of two main findings. One was that even a pretty small hassle had a big impact on who gets enrolled. A small hassle was the requirement to choose among health plans actively. That extra step of enrollment reduced enrollment in the program by 1/3. Second, what we saw is that wasn't just an evenly distributed reduction in enrollment. It was bigger for some groups than others. And the biggest reductions in enrollment were among young and healthy people, which kind of makes sense because a hassle is something you have to work to do it. And if you're young and healthy, you feel like I don't necessarily need coverage, or it's not as much of a felt need. That is a problem if what you're trying to do in health insurance is to get the young and healthy to participate so that it can help have a balanced risk pool to cover the high costs of individuals who unfortunately end up being sick. The big question guiding my research is, how do we make health insurance markets work? We know a lot from economics about how markets and competition can work well to benefit society, but we also know a lot from economics about how insurance markets and healthcare markets in particular fail in big ways. And so I think the goal of this line of research is to better understand what policy strategies can be put in place to have not just laissez-faire market competition, but regulated market competition that would yield some of the benefits of choice and competition that we know about from economics, while safeguarding against some of the flaws and problems that we know arise in insurance markets that have been shown for many years to be true in those settings.